working at Glory Reborn since 2005, May. Glory Reborn before is not like this. Before, we only had one building, one door apartment, and everything was here. Before, we don't have any social worker, one office staff, only Sir David.
Glory Reborn started in 2003. This first clinic actually started in our small apartment. The small, hot, no aircon living room. Our apartment became a place for mothers to come and seek health education classes. We took this opportunity to share with them not just about health, but also the hope of Jesus, the life that was growing inside of them, the miracle that was ahead of them. We had a spare bedroom. We actually did our first delivery in the spare bedroom of our apartment. This lucky mother woke up to David cooking her a homemade breakfast, and she had her vital signs checked by me throughout the night. And we just knew that the Lord was going to birth something bigger. What had started as just some simple prenatal classes and an opportunity to share the gospel, overnight turned into a place where life was literally being born. Over the 17 years of Glory Reborn's existence, we have birthed over 4,600 healthy babies, and we've cared for thousands and thousands of mothers coming through our education programs, our prenatal care programs, our postpartum programs, our breastfeeding support, our HIV programs, and we are so thankful that God has continued to expand the doors for us to reach mothers with health and the hope of Jesus. I think one of the things that this pandemic has really shown us is that mothers who were marginalized before have suffered so much through this pandemic. Being a mother and being so uncertain of where your next meal is going to come from, being uncertain of how you're going to stay in your home, being uncertain of if you have a job and when that job will return. We are so honored to be able to be a source of hope. Glory Reborn remained open to serve marginalized mothers and babies throughout this COVID-19 pandemic. We have equipped and protected our staff, our incredible healthcare team, our mothers, and our babies to ensure that they still have that safe place of holistic quality care during this pandemic. Perhaps one of the greatest changes that we've made is developing our telehealth program. Mothers can access quality care with a skilled healthcare provider around the clock through our telehealth program. The COVID-19 pandemic has certainly affected our finances. We were never expecting to budget in for things like these PPE spacesuits, respirator masks, redoing a lot of our clinic to ensure that mothers and babies have the ultimate safety and to protect our staff. We are so thankful for the community that has rallied around Glory Reborn. Locally, internationally, we have felt your presence more than we've ever felt before. My dream is to see Glory Reborn grow into a bigger facility, to grow into a bigger capacity, to grow and expand and offer our services to more and more mothers and babies. I want to invite you to be a part of seeing God's glory reborn in the lives of mothers and babies. From generation to generation, together we can see God's goodness, God's health, God's hope, God's glory birthed in a nation.